good afternoon. Thank you for joining us on Giving Tuesday. I'm Diana Shineman. I'm the Vice President for Research and Medical Programs here at the Tourette Association.
And I'm Neuringer, and I'm the Program Assistant for Research and Medical Programs at the Tourette Association.
And we think we have the best jobs here at the TAA because we are in charge of making sure that all the funding that comes into the association goes out to programs that are impacting the community and are really serving our mission of awareness, research, and support. And so we're really excited to tell you a little bit about some of the programs that are happening and that have been going on this past year or so. So I'll start out with our Young Investigator Award program. This is research grants funding that goes to early career scientists. And this goes to scientists that are trying to understand more about the mechanisms in the brain that might be causing Tourette syndrome, that are studying clinical research and strategies to improve patient care, and that are testing new therapies and new treatments. In addition to this groundbreaking research that the program supports, it also develops a pipeline of young researchers that will hopefully spend their careers dedicated and focused on Tourette syndrome.
Last year we received 26 applications that were very competitive for this program, but we were only able to fund 5. There were a ton more that showed a lot of potential, but with a little bit further funding, we'd definitely be able to continue expanding into more research areas. We also run a National Center of Excellence program, wherein we recognize medical institutions that offer the highest level of care and are undertaking groundbreaking research, or they're leaders in training and education, or they're providing community outreach and advocacy for the Tourette syndrome community. So there's 20 centers that applied last year that came through, but we also accept rolling applications, so every year there's an application process, and if you know of any centers that might have any interest in applying, please refer them to us. There are quarterly webinars that we run for the Center of Excellence, as well as meetings that focus on topical issues impacting patient care, and one annual face-to-face meeting as well.
And this program is an unfunded program, so that means that all of the doctors and the researchers that are leading these centers are not getting funding from the TAA for the work that they're doing, and they're really volunteering their time, and so they really want to help the community and make an impact on patient lives. But we recognize there's still gaps, and if we could provide more funding to this program, this could go to funding research coordinators that could provide enhanced coordinated care, providing more services that help with the transition to adulthood, provide platforms where we could collect data and pull that data to understand more about the prevalence of Tourette syndrome and why some people get worse over time and other people get better over time, and also going to provide funding for those who can't afford care. So we would love to have more funding to expand this program.
We also run BTI trainings, Behavioral Therapy Institutes, wherein we travel around the country training healthcare providers in CBIT, which is the first line recommended non-medical treatment for Tourette syndrome, according to the American Academy of Neurology. So we had 4 trainings in 2020 in Orlando, Birmingham, Long Island, and Minneapolis, but it looks like we're on track to run 7 or 8 of these in 2020. So keep your eyes peeled on the research and medical area of the newsletter as well as our website, and they'll be able to direct you to more information about these. Because TS is present in up to 1 in 100 children, but at this point we still have less than 300 CBIT certified providers on our provider listing, so there's an enormous gap here. And we're looking forward to expanding our provider listing to include multilingual providers as well as providers of telehealth services that are willing to treat patients remotely.
And we have a ton more programs which we don't have time to tell you about today, but I do want to recognize the amazing expertise of our Medical Advisory Board and Scientific Advisory Board. Through their support and expertise, we have working groups focusing on topical issues such as deep brain stimulation, genetics of Tourette syndrome, neuroimaging, medical marijuana, behavior therapy, among others. You can learn more about all those programs on our website. And we just want to stress that every donation made today will be doubled thanks to the Oxman Foundation. So that means double the impact for the community. You can visit Tourette.org/Giving Tuesday to make a gift. And if you can't donate money, or if you want to do more than just donating money, there's tons of other ways to get involved and make a difference. One is that you can get involved in research. You can visit the clinical trials section of our website to learn more about research studies that are looking for participants. Some of these are just simple surveys. Some are actually traveling and testing out a new medication, or just studies that are trying to learn more about Tourette syndrome in patients that that have the condition. And also tell us about the issues that are important to you. All of our programming is driven by the community and what you want us to focus on, and so we want to hear from you.
Definitely stay connected. Sign up for our monthly Tourette Connect newsletter, and you can also learn more about the work that we've accomplished in the last year and in the entirety of our existence at tourette.org/support.
That's it. Thank you.
Thanks, guys.